Biospine. The key features of flexible cage are characterized by the originality from material and design. Nitinol, shape memory alloy, has been adopted as the raw material of cage instead of Ti6Al4V or PEEK. We have changed the functional design from traditional block type to plate spring type. Thus, flexible cage can make the best of not only advantages in material such as superelasticity and shape memory effect of nitinol, but also advantages in design such as shock absorption of plate spring. As a result, we invented the functional cage differentiated and improved prominently in terms of flexibility. As the fundamental role of cage, the flexible cage system can recover height of intervertebral disc and achieve natural angulation of intervertebral disc. In particular, in order to be applied to disc height and angulation different according to the condition of patients, the flexible cage system has various sizes in height and angulation. As a result, by opening lateral foramen sufficiently, it can be used effectively for such typical indication as spinal stenosis and foraminal stenosis. The flexible cage system makes it possible to achieve the functional recovery in biomechanics, similar to normal load transmission mechanism. When the flexible cage system is applied to the anterior part of spinal column, if BioFlex spring rod system by flexible rod is applicable to the posterior part of spinal column at the same time, facet joint of posterior part and intervertebral disc of anterior part can function normally in terms of shock absorption. Therefore, load-sharing ratio of anterior part and posterior part can be restored to the ratio of 80:20, normal load-sharing ratio. Higher fusion rate of anterior part can be achieved by the flexible cage system. In the combined case of the BioFlex spring rod system and the flexible cage system, since the change of material and design makes flexibility enhanced, we can expect load transmission mechanism similar to the normal. Thus, continuous micro-motion and stimulus are applied to the contact surface between the surface of the flexible cage and the end plate of vertebral body, so that the secondary bone formation can be promoted by the Wolff's Law, without the help of bulky anterior support. Therefore, we do not have to be concerned about cage migration. As another advantage of the flexible cage system, we can prevent cage subsidence. It is one of the most important and frequent side effects of traditional cages, so that most of reoperation or revision regarding cage has been mainly caused by cage subsidence. However, the flexible cage system has an elastic modulus, very similar to that of normal intervertebral disc and end plate of vertebral body, compared to traditional cages. That is, thanks to superelasticity of nitinol and shock absorption effect of plate spring. The flexible cage system can minimize reaction force applied to end plate of vertebral body, which originates from axial compression load applied to cage. Since the flexible cage system makes good use of self-setting by shape memory effect of nitinol, it has a very strong advantage in surgical procedure. That is, since flexible cage can be easily compressed in the water at 4 degrees Celsius, the height of cage becomes lowered. After it is inserted in the space between vertebral bodies, the flexible cage returns to the original shape at body temperature. However, since traditional block cages cannot lower the height of cage, they impair the end plate of vertebral body or cause such problem as malpositioning in the process of insertion. On the contrary, thanks to shape memory effect, flexible cage can minimize the impairment of the end plate of vertebral body and prevent such problem as malpositioning.